nice to see familiar faces, and with this setting it's really important to kind of look at people and engage with the audience as well. So again, thank you for having me today. My name is Keyrellous Adib, and I'm coming from the WHO Regional Office for Europe in the Data, Evidence and Digital Health team. And basically today I'm going to go through the status of digital health literacy in the region. So I'll go through in my presentation about quick background, and then I will dig deeper a little bit by numbers. What are the numbers that we have? And what kind of way forward we are kind of forging towards the future of digital health literacy and how to improve it. Digitalization status across different countries. And the good thing is that COVID-19 already produced some sort of momentum that we are using at the moment to push through and advance digital health in the region. And this created what we call digital health fever. So right now, it's not about like the lack of different digital health solutions, but maybe we have a lot of digital solutions, but less regulation. And these solutions, not necessarily all of them are human-centered or patient-centered. So we have a lot of solutions that we see that are not regulated, or at the same time, if they are regulated, they might be regulated, but they are not tested well in terms of utilization and acceptance. And we can see that sometimes like people struggle using them, or like it's actually a struggle also to kind of scale them up so they can be successful on a pilot phase. But when it's like rolled out at a national level, at that point, it can be quite difficult. By numbers, I will give like two main highlights, two quick highlights. One is from the WHO Action Network on measuring population and organizational health literacy. And these are cross-national surveys conducted in Europe. Currently 17 member states are participating in these surveys. The preliminary results are showing that 22 to 58% of the populations across the different nations are struggling or finding difficulty in acquiring health information delivered digitally. The second is a report and survey that's close to my heart, which was released last year in September 2023. And it covers all the 53 member states. So all the 53 member states participated in that, but the response rate for the questions was varying between different countries. And it took the data collection period was from April to October 2022. And it builds on the 2015 survey, which is a global survey that was conducted before that. So, but like this time is more of an amendment, so that like we capture all the advancements that happened during and after COVID-19. So these technologies that are kind of transforming the dynamics basically between the patients and health workforce and the interaction between them and the health systems. First is national digital health portals. 71% of member states reported having national digital health portals. 77% of member states reported telemedicine and remote patient monitoring, and in fact, teleradiology is more prevalent than telemedicine and remote patient monitoring. And 91% of member states have at least one government-sponsored mobile health app. So, looking at the policies governing these technologies when it comes to digital literacy and inclusion. So in order to ensure that leaving no one behind, it's important to have policies and strategies and action plans, what we call inclusion plans. What if people are not able to access this technology? What is the government should, or maybe in a different setting, a company should do in order to accommodate for those people? And